Ooh la la la. Ooh la la la. Ooh la la la.
What's up, y'all? It's your girl Michaela Tierra, and I'm back with another video. If you are new here, go ahead and like, comment, and subscribe. If you have been rocking with your girl this far, welcome back. So y'all, I'm super excited because if you already haven't noticed, your girl has hit 1,000 subscribers on YouTube, y'all. I am completely I'm speechless, honestly. And thank everybody for, supporting me, subscribing, interacting. It really means a lot. I definitely would not have made 1K without the subscribers. So I thank y'all so much. I'm literally just, I don't really know what to say. I remember when I first started my YouTube channel back in November, I pretty much just started just winging it just to see what happened and where I would go. And here we are. It's April and your girl has hit 1K. So I must be doing something right. So that just goes to show, things can be scary to start at first, but never sleep on your potential. Definitely do things that are out of your comfort zone because that might just be, the thing that works for you. So I'm super excited to see where the rest of my YouTube journey goes. And yeah, let's just keep the subscriptions coming, y'all, because the videos will keep coming and I'm just gonna get more comfortable with this YouTube stuff. Y'all will watch me grow doing my YouTube channel, so it definitely really means a lot for the support. But basically for this video today, I just wanted to answer a few questions that people have been asking me, just as far as oral hygiene tips, different questions that I've been asked, and different questions that actually my patients ask me a lot as well. So let's just go ahead and get straight into the questions. So one of the main things that I usually get questions about is a deep cleaning versus a regular cleaning. So if you are new here and you don't already know, I am a dental hygienist. I have been a dental hygienist for going on, actually next month will make 5 years since I've graduated dental hygiene school. And I've learned a lot, not even in school, but just actually being in the work field and working, you learn a lot while actually doing the job. So one of the main things that people always ask is, do I need a deep cleaning? Especially people who haven't been to the dentist in a long time. So just to start off, basically a deep cleaning, so you'll see here either a deep cleaning or a prophy. In dental hygiene terms, we call it a scaling and root planing or deep cleaning. So pretty much a prophy is just a regular cleaning. So that is above the gum line. We do get tartar buildup that is above the gum line. Use the spin brush to polish your teeth, floss, all that good stuff. The prophy is the cleanings that you get every 6 months. Those are typically for people who have, fair to good oral hygiene, not really a lot going on, just run the middle cleaning, or what we call a regular cleaning. Now, a deep cleaning or a scaling and root planing, that is specifically for people who have gum disease. So just because you haven't been to the dentist in a few years, it doesn't necessarily mean that you need a deep cleaning. So for a deep cleaning, that means that you have bone loss underneath your gums. And once you lose bone under the gums, it's something that doesn't grow back, but we can maintain it by doing the deep cleaning. So whenever you need a deep cleaning, you are numb for that because we do have to go underneath the gums to clean buildup from off of the teeth. Sometimes we can see something called tartar buildup on the x-rays, or what we call calculus. The place that some people see it most is right on the back side of their lower front teeth. It's like a yellowish buildup that doesn't brush or floss off. But a lot of the times for our deep cleanings, we're going underneath the gums to clean that buildup off from under the gums. Basically, that buildup sits around the tooth, and the bone that supports the teeth into place sees that buildup as a foreign object. So eventually the buildup starts to run away from that, and the bone starts to run away from the buildup, and losing bone under the gums can potentially result in tooth loss. if you lose too much bone. So anytime I have patients that need a deep cleaning, I always tell them, gum disease is something that is considered maintainable but not curable. And the reason it's not curable is because you can get a deep cleaning all day, every day. Your gums can go back to health. And then if you don't stay on that routine of coming, more frequently for your cleanings, that gum disease can come right back and you could need a deep cleaning all over again, which is why typically for patients who need a deep cleaning, we have them get their teeth cleaned every 3 months instead of every 6 months, because they have a higher risk, of losing bone under the gums, and we want to make sure that everything is stabilized. So prophy is regular cleaning. Scaling and root planning is a deep cleaning. Now, typically with gum disease, usually the first signs you'll see is your gums will bleed, unless you're a smoker. I always tell my patients, I tell them, your gums, have you noticed your gums bleeding? Some of them say no. And I ask them, are you a smoker? Usually the answer is yes. So basically what happens when you're a smoker, the blood vessels in your gums get constricted, so you don't see as much bleeding. So smoking can actually mask gum disease. So some people may have it and not even realize it because their gums aren't bleeding and they feel like nothing's wrong. So that is why it's super important to keep up with your dental appointments. Get those x-rays. Do not be that person that is refusing x-rays, because although we're taking like a visual look in the mouth, the x-rays help put everything together. We can't see everything under the gums without the x-rays. So that's the difference between deep cleaning and regular cleaning. And like I said, just because it's been a while since you've been to the dentist, that does not necessarily mean you need a deep cleaning. But whatever hygienist that you see, they'll take what are called probing measurements. Usually that's when we go around the gum tissue and we poke around with this instrument called a probe, and that measures millimeter readings of the gum tissue and the bone that holds the teeth into place. So you may hear like 222, 333, 232. Those numbers are like regular cleaning numbers. Now, when you hear 4, that means gum inflammation or gingivitis, which is reversible. And it's not really something to be, scared about, because 4s, most people have some 4s, especially around like the back teeth, because they're harder to keep clean. But when you start hearing numbers like 5 and higher, that's when we start to become concerned about like bone loss underneath the gums. So make sure your hygienist is probing. If you are a hygienist, make sure you're probing your patients, because there are some hygienists that get a little lazy and don't want to probe, but it definitely makes a difference. So the next thing, this is some questions that I've actually had people ask me as far as oral hygiene tips and what are some good things to do. So toothpaste. People may think that all toothpaste serves the same purpose, but each toothpaste does something different for your teeth. So I get asked all the time, what is a good toothpaste for me to use? Well, that pretty much all depends on what you're looking for or how your oral hygiene is in a whole. So whitening toothpaste is usually what most people want to get, because most people want their teeth to be whiter. So I always tell patients, if you're looking for whiter teeth, get you a good whitening toothpaste. The one that I love and I use is called Colgate Optic White, and that's my favorite whitening toothpaste. Now with any type of whitening toothpaste or whitening strips or anything you use at home, never expect immediate results, because there is a very low concentration of bleaching gel in that whitening toothpaste. So you have to consistently use it for a couple of weeks to months for you to even realize a difference. And if you're a person that, drinks a lot of coffees, teas, you're a smoker, and you're using the whitening toothpaste, then you're probably not going to see the results that you want, because you're doing a lot of things that possibly stain the teeth. If you have acid erosion on your teeth, if you don't know what acid erosion is, that is pretty much the breakdown of the enamel. It'll cause your enamel to look thinner and your teeth to kind of have more like of a natural yellow hue. People who have like GERD, acid reflux, any type of like stomach acid issues, those are the people who usually have acid erosion on their teeth. And acid erosion can actually weaken your enamel. So I usually recommend something like Pro Enamel toothpaste. Sensodyne makes a Pro Enamel toothpaste, or you can get any other brand of toothpaste, but make sure it has enamel health, because you want to kind of build up that enamel, replenish it, and make it stronger again. Another thing that actually can cause acid erosion on the teeth, which is really popular for people, is lemon water. I know everybody wants to be on the lemon water streak, it's healthy, yada, yada, yada. But when you drink lemon water for a prolonged time, that actually can slowly cause acid erosion on your teeth. Lemon is very acidic. Although you're putting it in water, you're sipping on lemon water and you're pretty much washing acid on your teeth, especially if you drink it pretty often. So if you are a heavy lemon water drinker, definitely cut back, because you will definitely start to notice acid erosion on your teeth, which usually results in like a yellower appearance of your teeth. Sensitivity. So if you're having like really bad sensitive teeth, I usually recommend Sensodyne. Sensodyne is usually the number one go-to. The thing about Sensodyne that helps with sensitivity, it has an ingredient in it called potassium nitrate, and that is what seals into the enamel and helps to make the teeth not sensitive anymore. Now, just like any other toothpaste, you definitely have to use it for a while to actually even notice the results. So never think that you can, start using it one night and you're going to see results the next day. You literally have to use it up to like 4 weeks for you to even notice results. And then I do know that Sensodyne is it's a little bit more of a pricey toothpaste. So if you don't want to get the Sensodyne brand, you can get any other type of toothpaste. Just make sure it says sensitive on it, because they all have that same active ingredient. Now, one thing for the sensitive toothpaste, especially, well, you're actually supposed to do this with any toothpaste, especially sensitive toothpaste or like a whitening toothpaste. You want to just brush your teeth, spit out as much of the extra toothpaste, but don't rinse it off of your teeth, because you want the active ingredients to actually soak into your enamel and actually work. And like I said, that's with any type of toothpaste. With toothpaste, they have active ingredients that help your teeth. So if you brush your teeth and rinse with water or a mouthwash after, you're pretty much defeating the purpose in washing all of the active ingredients off of your teeth. So when it comes to like a home care or hygiene routine, I usually recommend floss your teeth first, use your mouthwash, or floss your teeth first, brush your tongue, use your mouthwash, and then brush your teeth afterwards, to get so that toothpaste can sit on your teeth and it'll work better that way. Another toothpaste for tartar control. There's numerous types of toothpaste. So if you're one of those people who get a lot of plaque buildup or like tartar, like hard tartar on your lower teeth, you need something with tartar control. Colgate Total, it has tartar control. Look at the active ingredients on your toothpaste. If you notice you get a lot of hardened buildup, make sure it says plaque and tartar control. Now, I will tell you, plaque and tartar are preventable. It just all depends on how you're brushing your teeth. But I do know a lot of people tend to get buildup on the backside of the lower front teeth. That is like really the most common area to have some hard buildup. So get you some type of toothpaste that says tartar control. If you have gingivitis or bleeding gums, you need something that has gum health on it. There's a bunch of different toothpaste that says gum detox, gum health. Specifically for bleeding gums, I usually recommend a toothpaste called Parodontax toothpaste, because it works really good to help with bleeding gums. And then also, you just got to make sure you floss. If your gums are bleeding, you have to floss. Even if they aren't bleeding, you must floss your teeth. I know a lot of people feel like flossing is like an optional thing, or they have spaces between the teeth, so they feel like they don't have to floss as much. But let me tell you, when you don't floss your teeth, not flossing your teeth is the equivalent to going to the bathroom, doing a number 2, and just not wiping your butt. That's the equivalent to not flossing. So usually for my patients who aren't flossers, I usually recommend that they start flossing every night before bed. That way, everything you've eaten throughout the day gets gone from in between your teeth, and you're not going to bed with food and gunk between your teeth. It really, flossing really helps. It helps with gingivitis. It helps for better breath. So floss your teeth, make a habit of it because it is super duper important. Even if your gums are bleeding, that means you need to floss more. Floss, the gums might bleed, but that's just because you're disturbing bacteria that you usually don't disturb. But the more you floss, the less the gums bleed, and then eventually your gums won't bleed anymore. So another thing that people always ask me is about breath control. How do I cure, or how do I get rid of bad breath, or my breath always smells bad? What can I do? So usually the number one thing that I always tell patients to do is start by brushing their tongue. If you have white coating on your tongue, that means you need to go brush your tongue. So our tongues are pretty much like a carpet. So visually they may look flat, but if you put your tongue under a microscope, you're gonna see like raised hairs on the tongue that, well, not hairs, but the taste buds are raised, kind of like a carpet. So they do pick up a lot of things, which is why when you eat something that has heavy color in it, it may stain your tongue because it's down into your taste buds. So every time you brush your teeth, you need to be brushing your tongue as well, because that is what helps with the bad breath. Now, those bacteria that can cause the bad breath, they sit way at the back of the tongue towards the throat, which is why you have to get all the way back there. I usually tell my patients, start on one side of the tongue, go all the way back, as far back as you can comfortably, scrape forward, rinse that under the sink, go to the middle, scrape it, rinse, go to the other side, scrape it and rinse. If you aren't doing that rinse in between, it's pretty much like brushing all of that stuff all over your tongue, and it really defeats the purpose. So make sure you brush your tongue, because that usually is like the number one cause why people have bad breath. They just aren't brushing their tongue. And like I said, if you have a white coating on your tongue, that means you need to brush your tongue more. Another thing that can cause bad breath is dry mouth as well. So the number one cause of dry mouth is usually taking a bunch of medications. Most people who take medications, they tend to have a drier mouth. That's like the number one side effect. There is a mouthwash called Biotine that helps with dry mouth. You can find it in any type of store that usually sells mouthwash, but it actually helps to lubricate the mouth and not make it so dry. I've had some patients say they don't like the taste of it. So if you don't like the taste of the Biotine mouthwash, get you any type of mouthwash that says alcohol free. So there's the mouth rinses with alcohol, and there's the alcohol free. If you're using a mouthwash that burns, then it has alcohol in it. And basically what that alcohol does is it dries your mouth out even more. So typically for anybody, alcohol-free mouth rinse is usually the way to go. That way you don't get that like burning sensation, and it doesn't dry your mouth out even more. Some good alcohol-free mouthwashes to use. Breath RX is a really good one. You can find that one in Walmart, and it is alcohol-free. Listerine Total is an alcohol-free, well, I think they make one with alcohol and one without alcohol, but you should see alcohol-free on the actual label. And the good thing I like about Listerine Total as well is it has fluoride in it. You definitely want something with fluoride, because the fluoride is going to help, keep cavities off of your teeth. So yeah, alcohol-free mouthwash is definitely the way to go. Make sure you gargle your mouthwash, get it all the way back when you gargle, because like I said, all of those germs that cause bad breath sit way at the back of the tongue. So gargle that mouthwash, get it all through there, brush your tongue, make sure you don't have a white coating, and that should help with the bad breath. If you're still having bad breath after doing all of that, then it may be some type of gastrointestinal issues, and you may need to go get checked out. And also, something else that can cause bad breath is tonsil stones. Basically, tonsil stones are like these, if you ever look at the back of your throat and you notice these white splotches in your tonsils, those are tonsil stones. And basically that's food and debris that gets stuck into craters of your tonsils, and it creates hard calcified stones. Those can definitely make your breath smell horrible. If you've ever had a tonsil stone and you picked it out yourself, they smell horrible. So If you're a person that is prone to getting tonsil stones, then you may need to maybe evaluate or go to an EMT so they can maybe evaluate about getting your tonsils taken out. So another question that people have asked me is, do cavities go away on their own? And the answer is no. Once you have a cavity on your teeth, it's not gonna go away unless you get a filling. Now, if you've ever been to the dentist and the dentist says they wanna put a watch on a tooth, that means that you have a small cavity on that tooth, but it hasn't passed the enamel layer yet. So sometimes the dentist may say we can watch it because you can stop, that cavity can stop where it is before it gets bigger. Those areas they don't go away, but they can remineralize if you floss and brush like you're supposed to. But once that cavity reaches the inside of the tooth, or what's called the dentin layer, it's no return after that. You have to either get a filling if it's small enough, or if it's reached the nerve of your tooth, that's when you get into getting what's called a root canal. So a filling is just simply cleaning out that small cavity area. They put either what's called a composite filling, which is tooth colored filling material, or they'll put amalgam filling material, which is the silver. My office only does composite fillings, but I do know there are some offices that still do amalgam. Once you get into root canal territory, that just means that that cavity has reached so big that it gotten into the nerve of the tooth, and it doesn't always hurt. A lot of people may think that, oh, well, my teeth aren't hurting, so I don't have cavities or I don't need a root canal. Teeth that need root canals are like ticking time bombs, because it may not hurt now, but usually what happens is you wake up one morning, your face is swollen, you got infection, or you get what's called an abscess or a bump near that tooth on the gums. That's why, like I said, it's super important that you go to the dentist, because taking x-rays is what helps, you know, the hygienist and the dentist to notice things like that. If you aren't getting x-rays, we can't give you the best diagnosis for the conditions that you have. So don't be that person going to the dentist refusing x-rays, saying that you don't want radiation. I will tell you, getting x-rays at the dentist is less radiation than going outside in the sun. So when I tell you they are completely safe, they are safe. Going back to the cavities, one thing that is super important to know about cavities is that your diet plays a huge role in, you know, cavities forming on the teeth. So the number one way that cavities form are sugar and acid. You mix those two together and constantly have that on your teeth, and then you're gonna get cavities at some point. One of the number one things that I see people love that is detrimental for your teeth is Mountain Dew. Mountain Dew is like pouring battery acid on your teeth over time, and it's just not good. That's why you definitely have to make sure you watch what you eat and drink. If you are one of those people who are very, you know, sweet prone, you love candy, sweets, all that stuff, you can have those things, but you definitely have to make sure you ramp it up with your brushing and your flossing. If you can't get a toothbrush in right away, switch your mouth out with water or something, because if you're constantly eating that type of thing, that's just sugar and acid constantly brewing on your teeth. Even some bottled waters, let me go back. Water is the number one healthiest thing for your teeth, but there are some bottled waters that are acidic. So that's why you should definitely look at the pH of the water you're drinking. A lot of people are going more so towards like the alkaline waters because they're more basic. Water is supposed to be neutral. On the pH scale, it's a 7. That's considered neutral. If it's anything below a 7 for your water you're drinking, that means it's acidic, which is detrimental for your teeth. So, of course, make sure you do your research, because don't nobody want a bunch of cavities on their teeth, okay? But I think that's it as far as, you know, just some oral hygiene tips. If y'all have any more questions about oral hygiene, dental hygiene, anything, please ask or comment below, because I'm always open to answering questions. But I definitely want to thank y'all again for 1K. I'm just so happy. I'm grateful. I'm thankful. Thank you for the support. Go ahead and like, comment, and subscribe on the video. Please keep watching my videos because I have so much more in store for y'all. The vlogs, I got some other little surprises coming into video soon. So y'all stay tuned and I'll see y'all next time. Peace out.